Hi, I'm here with Lloyd List, the creator and CEO of CryoDerm. Hi, Lloyd.
Hi, Monica. Nice to be here.
CryoDerm has many therapeutic uses, and among them is the treatment of pain associated with muscle, joint, and neurological conditions. CryoDerm has an anti-inflammatory, anti-arthritic, anti-bruising, and anti-spasmodic properties, as well as having a stimulation effect on the vascular and lymphatic systems. CryoDerm may be used in office or at home, pre and post rehabilitation exercises, or as a massage medium on sore, stiff, painful areas. So Lloyd, we know that CryoDerm is a topical pain reliever, but maybe you could tell us how pain is caused or what the physiological effects are happening in the body that causes pain.
Sure.
Okay.
Well, in order to talk about topical pain relievers, I think it's really important to first understand a little bit more about pain. And in doing so, we need to touch on several areas. Whenever you have pain, you have involuntary muscle contraction. Involuntary muscle contraction causes a lack of blood flow to the area, called an ischemic condition. This causes a buildup of metabolic waste. Just as blood flow coming in is reduced, the removal of lymph and blood is also inhibited, which then causes pain and cramping and causes further involuntary contraction. And we now have the pain spasm cycle. Now, let's talk a little bit about how we make energy. This will help us understand one of the components of metabolic waste buildup. You make energy two different ways. Anaerobically. Anaerobically, you take one glucose molecule and you break it in half and you get 2 pyruvates and 2 ATP, adenosine triphosphates. They're energy units. This doesn't require oxygen, but then because of the ischemic condition, the pyruvates remain in the cytoplasm too long and they ferment into lactic acid. Lactic acid contributes to muscle soreness and fatigue, and along with a lack of ATP, it leads to cramping and pain, furthering the pain spasm cycle. Then you make energy aerobically. Aerobically, you do the same thing and you begin making energy with the same cycle. But then instead of the pyruvates, they enter the mitochondrium and they're broken down in the presence of oxygen and mitochondrial enzymes, creating 36 more ATP energy units. And now you have a total of 38 energy units. This is a longer process than making ATP anaerobically, but the waste byproduct of this is carbon dioxide, which is what we breathe out, and water.
I felt like I was in Phys 101.
You were.
Little review.
So the lack of adenosine triphosphate, along with the metabolic waste buildup, it continues that pain spasm cycle.
I get it.
Good.
All right. So Lloyd, now that we understand the pain spasm cycle, maybe you can now tell us how CryoDerm helps stop that pain.
Sure. CryoDerm was formulated to immediately break the pain spasm cycle by overwhelming the topical receptors, thereby eliciting the gate theory of pain control.
Which we learned, again, in Physiology 101.
Yes, we did.
Yes, we did.
Once the pain signal is completely or significantly reduced, the muscles no longer need to be in involuntary contraction. As they begin to release, blood flows to the area, breaking up the ischemic condition. Energy begins to be made aerobically as opposed to anaerobically, stopping the production of lactic acid and the buildup of metabolic waste. While this is happening, the essential natural ingredients in the formula are penetrating deep into the tissue to create a long-term anesthetic effect.
Right.
The delivery of these key ingredients is aided by MSM, which regulates the sodium-potassium pumps in the cell, thereby increasing permeability. Once delivered, peppermint oil stimulates the vascular and lymphatic systems, further aiding in the removal of metabolic waste and the reversal of the ischemic condition. Additionally, other vital ingredients in CryoDerm have anti-inflammatory, anti-bruising, anti-spasmodic, and antiseptic properties.
So Lloyd, you were discussing the gate theory of pain control. Now, we as therapists, we did study that, but it's been a long time since I've been in school, so maybe you can do a little overview.
Sure.
Great.
Okay, Monica, I'm going to give you a basic overview to ensure that we're on the same page. Deeper pain signals such as muscle cramps and aches run on small unmyelinated nerve fibers, meaning they conduct signals slower than topical thermoceptors, which are large myelinated nerve fibers. This is really important because those signals, those topical signals, are priorities, and we need to know about them right away. They could mean there's imminent danger or that you could get burned, so we take immediate action when those fibers go. So that signal is very fast and instantaneous. Now, understanding that gives us the basis for the first action that CryoDerm has on the body, which is eliciting the gate theory of pain control. Peppermint oil creates a burning cold sensation when applied to the skin that's short-lived, while eucalyptus creates a warming sensation. These two products, when combined in proper proportion and percentages, create an enormous amount of sensory information.
Now I'm hearing peppermint oil and eucalyptus, which we know as plant-based.
Yes, they are.
Right?
That's correct.
Aromatherapy.
That's
with
correct.
highly therapeutic benefits, and this is obviously what you're talking about right now.
Yes.
So CryoDerm doesn't just have its pain relief, you have other things going on.
Correct. Well, these ingredients are in there because what we're trying to do is, and I'll give you a little bit more about this, is those two products, when they're combined together, the sensation is overwhelming. And the treated area then begins to send an enormous amount of information via the large myelinated nerve fibers. Basically what you're doing is we're overwhelming the information network and beating the deeper pain signal to the spinal cord.
Nice.
And blocking out that deeper pain signal, either completely or significantly decreasing it. When that happens, the muscle no longer needs to be in an involuntary contraction, and this means that blood flow begins to come back into the area, removing toxic metabolic waste, correcting the ischemic condition, and bringing with it oxygen, allowing ATP to be made aerobically as opposed to anaerobically, which stops the production of lactic acid buildup.
Lactic acid we do not want.
Yep.
Excellent. Lloyd, in our last conversation, we discussed a little bit about some of the essential oils that were there, the peppermint and the eucalyptus. Now, I know CryoDerm is full of other natural ingredients that have these therapeutic benefits. Can you elaborate a little more on those ingredients?
I can.
Awesome.
Okay. CryoDerm contains a proprietary blend of natural ingredients, each of which has a specific purpose and works synergistically with one another. Let's take a few minutes to talk about each one of them. And we'll start out with arnica.
Okay.
How's that? Arnica is an amazing and well-known product. It's used topically by plastic surgeons around the world, and in fact, research studies at the University of California, San Francisco Medical Center show topical applications of arnica to be effective in reducing bruising, swelling, edema, and hematoma.
Now, I know with arnica, a lot of people will actually take it also internally, not just topically.
Absolutely, and works very well that way too.
Very good.
Then let's talk a little bit about boswellia. It's also used topically by plastic surgeons, usually with arnica in a preparation.
Now that I didn't know that.
Prep. Yes. It also has anti-inflammatory, anti-arthritic actions, and in acute and chronic models of inflammation, boswellia reduces swelling, increasing mobility, and thereby effectively reducing pain.
Excellent.
Eucalyptus has been used for centuries. It's a pain reliever with warming properties that's also antibacterial in nature. Ilex, which is derived from the holly shrub, has been known to reduce pain, swelling, and loosen stiff joints. And of course, menthol, it's used clinically as an anti-inflammatory and pain reliever. It causes a cold sensation on the skin by activating peripheral cold receptors. And then there's the MSM, which we also did discuss before. It's a naturally occurring essential nutrient found in healthy tissue and joints. Studies at the University of Oregon's Medical School reported that MSM has a wide range of pharmacologic actions, including topical membrane penetration, anti-inflammation, and local analgesia. And applied topically, MSM creates a tingling sensation. And then we'll move on and we'll go to peppermint oil. Peppermint oil has anesthetic properties as well as being a vascular and lymphatic stimulant. That's very important. Peppermint oil creates a short-term burning cold sensation on the skin, which is part of what we use to elicit that gate theory that we spoke about earlier.
Right.
Then some of the other products used in it are purified water. We don't use tap water. Our purified water, it's been cleaned by reverse osmosis, and this ensures that it's pure and has no chemicals in it. And the other thing that we use is SD alcohol 39C. And this is quite important. We never use isopropyl alcohol, which is man-made. SD39C is a natural denatured grain alcohol.
Just don't drink it.
Don't drink it.
Don't drink it. No. What I love about all of these ingredients that Lloyd was just talking about is that it does fit along with the one concept and working towards greening your clinic and your practice. Lloyd, also with your manufacturing practice, can you tell us a little bit about the bottle manufacturing?
Sure. All of our bottles and boxes are all recyclable and made with recycled plastics and recycled cardboards. So that's one of the things corporately that we think we're doing that's responsible. And of course we always urge the therapists to recycle our products too.
This is why we love CryoDerm. So now that we've discussed the gate theory of pain, we've discussed the ingredients of CryoDerm, maybe we could talk about when a therapist or a client can utilize CryoDerm, or when to apply it.
Sure. Okay, as far as the therapist goes, what we'd like to do is have the therapist work smarter, not harder, and let CryoDerm actually do some of the work for them. All that they need to do is massage the liquid gel into painful areas, and they'll be able to actually feel their client's muscle tension kind of go away as they're working on the body.
You know what, as a therapist, this is something that we certainly could appreciate. We could possibly be working on another part of the body while the CryoDerm is taking effect. Let's say there's muscle spasming, causing abdominal pain also. Would we not apply it then and then just go to...
Absolutely. I usually recommend that you apply CryoDerm pre-massage to the area that has pain, rather than waiting until you get to that area. So as you apply the CryoDerm, you'll feel the tension and the spasm kind of melt away. You'll feel it getting softer and softer. And it saves your hands as a therapist from undue stress, and it helps you avoid repetitive motion injuries. Once CryoDerm is applied, it stays lubrous and it maintains just the right amount of drag to perform the modality, whether it's deep friction, transverse friction, as well as other modalities.
So we really don't need to apply any other lubricant in conjunction with CryoDerm. It can actually work on its own.
That's correct. To the area that has pain, you don't want to use it as your lubricant for the entire body. But you want to use it on the area that has pain, and you use the liquid gel exclusively as your medium for massaging it.
Excellent.
Okay. CryoDerm never balls up, and nor does it exfoliate skin, which is why it's an excellent lubricant. Additionally, applying CryoDerm after and between massages aids in speeding up the body's natural healing process, and it makes the massage work more effective. So here are some uses for CryoDerm. It can be used in sports massage pre-event, and you use CryoDerm exclusively in place of lotions or oils on the areas of the body that will experience overexertion during the event.
Well, I got a whole old-timers hockey team that bathes in the stuff prior to getting on the ice, so I've certainly heard a couple of comments like that, that's for sure.
Oh, it'll work great. What it'll do is it will help warm up the muscles, and it'll draw blood flow to the area, releasing the muscles for enhanced stretching, and it helps to reduce the risk of injury and cramping during the event. It will also help your athletes perform at an optimal level and enhance performance by treating them with CryoDerm pre-event.
So how about after an event?
Well,
good to go?
Absolutely, and it should be used post-event. CryoDerm post-event is used to break the pain spasm cycle that's been created. Remember, they're using a lot of energy anaerobically because they need that instant energy, and it takes too long to make energy aerobically. So while they're doing that, there's a lack of adenosine triphosphate, ATP, that energy that they need molecule, and you're getting buildup of lactic acid. So when they finish that race or that endurance or whatever sport they're performing, CryoDerm will actually bring blood flow to the area, help break up the ischemic condition, and it'll speed the recovery and aid the body in its natural healing process. It'll also help prevent next day muscle fatigue, pain, and stiffness.
Excellent.
Okay. And then CryoDerm, actually, while you're doing therapy, is great after cold therapy. Applying CryoDerm then will enhance and prolong the cold sensation while additionally adding to the longer-term anti-inflammatory, anti-bruising, and anti-spasmodic effects.
So the CryoDerm helps prolong cryotherapy or cold therapy to prolong the treatment, obviously. How about heat therapy?
That's a great question. Now, due to the high strength of CryoDerm, I don't recommend that you apply heat to the area that's been treated because it can cause excessive hyperemia, discomfort, and potentially burn the patient. But for contrast therapy, you can apply CryoDerm 5 to 10 minutes after the heat has been removed. This will enhance the treatment and give longer-term anti-inflammatory, anti-bruising, and anti-spasmodic effects.
Excellent. So Lloyd, we got to talk about the use of CryoDerm in hydrotherapy, both hot and cold. Are there other modalities that we can utilize CryoDerm?
Absolutely. We talk about CryoDerm for range of motion. Now, CryoDerm releases muscle spasm and reduces swelling and inflammation, thereby effectively increasing range of motion and allowing the therapist to passively or actively move them through a greater range of motion. Reduced pain means therapy becomes easier and it creates greater compliance.
Well, I know a lot of golfers this season that are going to be wanting to use CryoDerm before getting out there.
Oh, absolutely.
Absolutely. So now I want to talk about your clients, because at One Concept we like to educate our therapists or our health professionals on allowing the client to take home some treatments. Is it safe for the client to be able to use it on their own?
Oh, sure. We would suggest that you tell your clients to purchase a bottle of CryoDerm and take it home for use in between treatments. And the reason why is that if you've given them rehab exercises or things to do at home, it's going to make them more compliant, as we said before, because it reduces the inflammation, reduces the pain. So that's one reason. And the other is that people do have pain issues between massages and between being worked on.
Yep.
And so it helps them manage their pain between office visits.
So Lloyd, maybe you can give us a demonstration on how to apply the CryoDerm gel, because your CryoDerm does come in 3 different formats. So we have the gel here, and I know there's also a roll-on for personal home use. Those are awesome. Those are probably #1 sellers for home use. And then there's the spray, and I think we'll get into later on doing spray and gel together.
Well, let me tell you a little bit, since you brought that up, a little bit about spray and gel and the differences.
Sure.
Most massage therapists prefer the liquid gel.
Right.
And the reason is because it's lubrous and it can be massaged in. Most chiropractors and other people, depends on the modality, prefer different types of applications. For instance, the roll-on is more of a home application as opposed to the spray or the gel.
Yep.
Now, the gel again works best in massage because it can be rubbed in, and in physical therapy where therapists like to manually work tissue.
Right.
The spray is wonderful for a chiropractor because after applying the product, they don't have it on their hands, and when they do a cervical adjustment, there's no danger of getting the product near the person's eyes. So that works best for that.
Excellent.
So why don't we do a little bit of work on your extensors, and I'll show you how to apply the product.
Right.
So what we're going to do is we're going to use it, and we're going to do 3 small applications. And I always recommend this as opposed to just doing 1 large. And the reason is that the first application, what's going to happen is as we begin to massage it in, it's going to dissipate pretty rapidly because the MSM, because it's regulating the sodium potassium pumps, is going to cause it to absorb rapidly. So what we do is we just effleurage right now. We're not doing any specific work, and that means we're just making nice, so to speak, and we're just rubbing it in, and we're not going to do any deep work. I want you to also keep in mind that CryoDerm is doing a lot of the work for you, so you don't have to actually work as deep as you normally would, and you don't want to. So as you massage it in and it begins to dissipate, then what you do is you give a second application, and we're going to do 3 of these small applications. So here's the second application. Okay, and now as you put the second application in, each application becomes slightly more lubrous, and it maintains its lubricity. And I'm going to work a little bit deeper now as opposed to just effleurage. I'm going to start to work into the tissue and use a small amount of pressure, maybe a little transverse friction.
Awesome.
And there we go, and we'll just keep working that, and some stripping with my thumb.
So we've started effleurage, and now we're working deeper, utilizing some of the techniques that us as massage therapists and even PTs, OTs may.
Correct.
Okay.
And then as we work it in, we gradually start going deeper and deeper. We don't go, but you, again, keep in mind, do not work as deep as you normally would, because we're drawing blood to the area, we're breaking up that ischemic condition, and what we don't want to do is damage tissue.
Right. Okay. And there's other areas on the body that we should try and avoid having the cryoderm, right?
Absolutely. Any soft tissue under the arms. Be very careful when you apply it not to get it under arms. You don't want it obviously in the eyes.
Yes.
If it gets in the mouth, nothing bad, will even die, but it tastes nasty. So there we're on the second application, and now if we're going to move, and we're going to do the third application. Okay. So now that we're on the third application, we have nice lubricity. It's staying nice and giving us just enough glide and just enough drag. And as a therapist, you have the ability now, as it gets to this point, if you choose to have more glide, you can put a dot more of the liquid gel. Right now, I feel like I have just the right amount of workability to do some stripping on the tissue, to do the fiber work, cross fiber, so I can break up some of that adhesion. And then even if we want, we could do some passive and active range of motion just to get those flexors and extensors. For instance, now that I've gone through and stripped the tissue, I could hold the tissue and have her go ahead and go into flexion extension. There you go. Great. See?
Releasing nicely. Yeah.
So I can pin the muscle and have her stretch. And what we're doing is we're actually creating a situation where we're deadening some of her topical receptors, and we're keeping that pain level to a minimum. And that's the way you would apply.
Now, you remember we had the conversation to prepare the tissue before we got into the massage. We applied the cryoderm and then maybe moved to another body part just to ease off some of the spasming. Now, obviously, I might not have spasming in forearm flexors or extensors, but would you apply the gel or the spray? Is there a specific...
You know, it's really a personal call.
Okay.
If you want to work the area, obviously, then you want to use the gel because you're going to use it as a lubricant.
And that's what we just saw.
We could have just sprayed the area, and we wouldn't have to work on it, and we could just leave it. I chose to because I wanted to show you how we can do some of that cross fiber work, break up some of the adhesion, which you probably would want to do as a therapist, a PT, or a massage therapist. And so that would be my recommendation. More of the spray, again, would be for the chiropractors post or pre-adjustment, to release muscle tonicity, deaden the spindle cells so that they don't elicit the same responses they normally would when they adjust. Because that's a problem. Sometimes after an adjustment, people will say, I feel a little bit sore the next day. And what the reason that is because, you know, chiropractic is based on speed when that adjustment takes place. And when that happens, you can elicit a response from the spindle cell, and what that does is makes those muscles, those little spinales, tighten up. And so spraying pre or post will stop that and have the patient not feel that way the next day. Now,
would you ever use spray and gel together?
We were going to get to that. Actually, that's the double whammy.
The double whammy.
That's the double whammy. If you have someone who is acute or in really serious pain, then putting on the gel first and massaging it in and doing the type of work we just did, and then after that spraying it really almost triples the intensity. So if you have a person who's acute and they come into you and they can barely be worked on, this is a great way to reduce that muscle tonicity and bring down the inflammation fast. You massage in the gel first, being very careful because they are acute not to create any pain, and just effleurage it into the area and then spray the area when you're done.
Now I know with my personal experience with CryoDerm, it seems to reactivate during the day, maybe by showering or sweating, and you feel it throughout the day. Can you tell us why this happens?
Yeah. One of the things that you should keep in mind is that you're going to feel the sensation from the CryoDerm for several hours, 2 to 3 hours after it's applied. But it doesn't mean that the product is not continuing to work even after the sensation is gone. Actually, it is continuing to work, and by reactivating when the water hits it, you know the product's still there on you. Yeah. So yes, if you sweat or you get wet and you shower later that evening, you're going to feel the CryoDerm and the sensation will begin again.
Well, I think also we know that with essential oils such as the arnica, the boswellia, the other herbal and natural products, they do go into the bloodstream, and they are there to continue to reactivate.
Well, absolutely. And there's a cumulative effect, so as you keep putting it on, if the person treats themselves later on, they'll actually have a cumulative effect, and it will get greater and greater.
Excellent. So we just saw a demonstration with Lloyd on the use of both the CryoDerm gel and the spray, and how it really increased the intensity of the treatment. I hear that there's something out there, another treatment with CryoDerm, that takes this even a step further.
There is.
Is there?
Yes.
Ah, you going to tell us?
Yeah, of course. It's called occlusion strapping. And actually, we didn't spray your arm before, but we talked about it.
Right.
About combining the gel application with the spray. And what this is called is an occlusion strapping. And basically, it's utilizing the gel and the spray together, again, as we would have done before.
Yep.
And then you need a few things, and let me tell you what you'll need. You'll need the CryoDerm gel. You'll need CryoDerm spray.
Right.
Okay. Now, we have a material we're working with that is not out yet, but you should look for this at one of your distributors. It kind of has a pseudo rubber backing and a material surface. But until this is available, what you're going to use is you're going to need a plastic contractor bag. This is just a very thick mill contractor bag, and a strip that we've cut out of it. And depending upon what area of the body you're working on, you're going to cut the width of this. So you'd have several different widths available to you in your massage room. So we've got these items here.
Great.
And then this is basically just a, it's a shrink wrap, and it comes from any of the office stores. You can get it, and I think it's 3.5 inches wide, and it's very stretchy and tight. What this entails is creating a greenhouse effect, so to speak, over the area that's been treated, which is that we're going to apply the products, and then we're going to occlude it so that you cannot sweat in that area, and we're going to wrap it very tightly, and we're going to drive the product in.
So you just explained that to me. Can I just get into treatment room and start doing it?
No, I wouldn't recommend that. Doing occlusion wrapping requires a little more learning and understanding of the treatment so that you don't damage the client, and it can potentially burn the client. So you do need to know the proper ways and the correct protocols in order to perform this modality.
So as a One Concept member, look for that next educational video on occlusion strapping with Lloyd List and his awesome product, CryoDerm.